Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. The Honorable, our judges and moderator on Iconers 2020. My name is Keliana Irawati. Now I will present about my research. The title is Mental Health Risk on Quarantine People During COVID-19 Pandemic, a literature review. This is my outline divided into background, method, result, and discussion. Background. On March 2020, World Health Organization declared to all of the world that COVID-19 had been a pandemic. On June 2020, there are 8.06 million citizens in the world had positive COVID-19 confirmed, and 440,000 people died because of COVID-19. COVID-19 pandemic says the government attention and makes some rules to praise the incidents. Physical distancing or social distancing has been applicable to do. The citizen must be obeying the rules and make some new adaptation. Pandemic COVID-19 is increasingly widespread, also closed several public services such as schools, playground, tourist attractions, and shopping centers. The people said that they felt isolated, worried, anxiety because they showed adaptation with pandemic condition. It's happened in October 2020. The suspects about 140.305 and the positive is increasing about 400,056. This is our problem formulation. What are the mental health risks on quarantine people during COVID-19 pandemic in Indonesia? The purpose is for general purpose and specific purpose. And the benefit are general publics, healthcare professional, and education institution. Method and tracing techniques. We use research design. Literature review was tracked with three databases, PubMed, Sage, and Google Scholar, and use Gray literature from WHO and Indonesian government website. The sample of this research, all of the articles which are discussed about mental health on COVID-19 pandemic. Inclusion and exclusion criteria. Inclusion criteria are article published in English language, peer review article, oral primary study types, and literature review study, cohort study, correlation study, and etc. Focus on mental health risk and COVID-19. Must include data, mental health risk, quarantine people, and COVID-19. The exclusion criteria are article with full text published in language other than English, studies focusing in other than mental health and COVID-19 pandemic. And this is our result. Conto Angelos, Kyrgios, and Papageros 2020 said that from Medline database with 65 articles said that children and elderly feels restless, worried, and scared during COVID-19 because they are included on vulnerable population who have a high risk of virus transmission. Ilpach and Nurwati 2020, a literature review study which is article collect from book, magazine, and other article said that they feel restless, anxiety, and fear with themselves, their family, and their significant others because of the pandemic pressure. The respondents also have a sleep disturbance, eating disorder, and feel depressed. Tang, Liang, Zhang, Mohammed, He, and Wang 2020 with the article COVID-19 related depression and anxiety among quarantine respondents said that quarantine respondents reported has more symptoms of depression and anxiety than respondents who were not quarantined. The other results said Torales, Virgin Tittle Ventriglio said that pandemic COVID-19 causing new physiological problems such as stress, insomnia, anxiety, anger, and fear. Vigo, 6 patent pager Cross 2002 in their topic mental health communities during COVID-19 said the emergence of anxiety and depression caused by decreasing in various aspects in affected country. And Pearson 2020 said that nurse and professional healthcare who caring the COVID-19 patient more prone to get stress, anxiety, sleep disorder, and depression rather than the nurse who doesn't care the COVID-19 patient. Carvalho Melo Soares 2020 on their research impact of social distancing on mental health during COVID-19 pandemic. An urgent discussion said that social distancing regulation had a mental health impact, especially for people who lost their jobs and income, affected decreased motivation, feel meaningless and lost their self-esteem. Walton Murray Christian 2020 in their topic mental health care for medical staff and affiliated healthcare workers during COVID-19 pandemic said that the uncertain condition of pandemic COVID-19 makes the healthcare profession mental health decreasing condition. Also, Jeff and Soto 2020 in the topic coronavirus or COVID-19 pandemic impact on mental health said that pandemic COVID-19 had an impact on mental health of children and elderly because of the negative stigma that goes to them who are infected or in a quarantine. The last result, Chen et al. Have a result that healthcare professions are also vulnerable population and they feel anxiety, depressed, and fear because of the pandemic COVID-19 situation that makes them isolated and get negative stigma. From the result above, we have a conclusion that this literature review tried to make a description about mental health risks on pandemic quarantine people during COVID-19 pandemic. Mental health risks that occurs on quarantine people are anxiety, stress, sleep disorder, depression, and PTSD. And these are a suggestion to for the citizen. Stop negative stigma on COVID-19 patient and the people under surveillance or under quarantine. For healthcare workers, nurses and other healthcare workers must be caring the mental health of clients besides they providing the physical treatment. For educational institutions, they must provide an appropriate health information and education to the public and the client under monitoring of COVID-19. Alhamdulillahirabbil alamin. That's all for me. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.